Mr. Chairman, and thank you, Ms. Spitzgo, for updating us on the work of the National Health Service Corps and what you're doing to provide access to primary care in underserved communities. And I want to thank you for all the work you're doing to help educate the next generation of healthcare professionals. Equal access to health care and primary care, regardless of where you live, whether it's a rural community, a suburban community, or in an urban center, is essential to assuring that Americans have an equal opportunity to full and healthy lives. And I recognize that equal access means that we have to have a strong workforce that's trained to practice in our evolving healthcare system, a system that's becoming more integrated and more coordinated over time. I'm proud to support the Medicare GME-funded residency programs at hospitals around the country, and especially our world-class hospitals in Massachusetts. But I recognize that we also need strong support for other federal workforce development programs, including the Corps. Across the board, these programs are dramatically underfunded, and they can have stringent eligibility requirements that leave many extraordinary programs without adequate funding. Now, people talk a lot about rising health care costs and how concerned they are about those costs. Can you explain how access to primary care reduces the overall cost of health care for individuals who are able to see a provider before they develop expensive complications?
Yeah, I think what we see and often read about is that getting care as soon as you have symptoms and not letting them progress further into the point where you need a much more serious treatment or a much more series of treatment really is very much less expensive. You can go and get on a routine, whether it's you look at diabetes, if you catch that early, you can get some training on lifestyle adjustments, and you can learn how to manage it and potentially never even end up on medication, as opposed to if it goes unchecked and you are very far and a much more of a further down the path of that complications with diabetes, then you're going to be on medications. You may be having problems, vision problems. You may have issues with your feet. I've seen my brother go through this, who went through it unchecked. So the cost you are incurring in the medical tests and the routine, whether it's vision or it's being hospitalized to deal with some of these issues, or the medications themselves, certainly greatly add to the cost of care.
So it's fair to say that early care, primary care, integrated care may reduce the overall cost of health care in the system. Is that fair?
Yes, I think that is fair.
Good. So the question I want to ask you then is, if we doubled the support for the National Health Service Corps, what impact would that have on overall quality of health for Americans and on costs to the healthcare system?
I think the cost one, I can't give you a number right off, but I think what we can see from a quality perspective and just access, being able to have people available. We often heard from our sites that, it's difficult for folks to get appointments. There's long waiting times to get an appointment. Their ability just to find the providers, when often a physician leaves, they may be 12 or 18 months recruiting a new physician. So not having someone there, obviously someone else is taking up that slack, because you still have patients to care for even once you've lost providers. So by being able to recruit and use the National Health Service Corps as a huge recruitment tool, we hear this from our sites all the time. They say, I don't know what I'd do without the National Health Service Corps. That is what brings me providers. And the more providers they can get as we try to place our scholars, they're like, give me more physicians. If you could just, I can use as many physicians as you can give me. So all of those things allow them to serve patients more. We have quality, significant quality of care being provided by our community health centers, and about 50% of our clinicians work in those community health centers. So we know that many more would also land in community health centers if we had more providers that we could support.
Well, thank you very much. Every time someone talks about the rising costs of health care, I hope they'll stop to remember that we have paths open to us to reduce the costs of health care. We know how to get better outcomes at lower costs, but to do that, we have to make sensible upfront investments. In this case, investing in the medical education of our healthcare workforce can give us all a great return. We can get better outcomes at lower costs. So I just want to say thank you very much. I want to express my support and to say, Mr. Chairman, I apologize. There's a banking hearing going on at exactly the same time, so I'm going to have to miss the second panel. Thank you.
Okay. Thank you very much, Senator Warren.